వెల్కమ్ టు లైఫ్ లైన్. క్యాన్సర్ అంటేనే చాలా మంది టెన్షన్ పడిపోతున్నారు. అందులో బ్రెస్ట్ క్యాన్సర్ కేసెస్ రోజుకు పెరుగుతున్నాయి. రోజుకు పెరగడానికి కారణాలేంటి? ట్రీట్మెంట్ విధానంలో ఏవైనా మార్పులు వచ్చాయా? ట్రీట్మెంట్ కరెక్ట్గా ఇస్తే బ్రెస్ట్ క్యాన్సర్ తగ్గుతుందా అనే విషయాలు తెలియజేయడానికి ఈరోజు మనతో పాటు ఉన్నారు స్టార్ హాస్పిటల్స్ బంజారాహిల్స్ అండ్ నానక్రామ్గూడ డాక్టర్ విపిన్ గోయల్, HOD డిపార్ట్మెంట్ ఆఫ్ సర్జికల్ అంకాలజీ, లాప్రోస్కోపిక్ అండ్ రోబోటిక్ సర్జన్. వారిని అడిగి మరిన్ని వివరాలు తెలుసుకుందాం. వెల్కమ్ టు లైఫ్ లైన్ డాక్టర్.
థ్యాంక్ యూ మేడం.
వై డే బై డే దిస్ క్యాన్సర్ కేసెస్ ఆర్ ఇంక్రీజింగ్ రాదర్ దెన్ డిక్రీజ్? ఎందుకంటే టెక్నాలజీ పెరిగింది అంటే తగ్గాలి కానీ పెరగడం ఏంటి? ఇంకోటి ఏంటంటే నేషనల్ క్యాన్సర్ రిజిస్ట్రీ ప్రోగ్రామ్ రిపోర్ట్ ప్రకారం నంబర్ ఈస్ టు బి ఇంక్రీజ్ మోర్. వై లైక్ దట్?
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರಂ. Cancer incidence is increasing day by day because of more westernization, change in the lifestyle. ఏమవుతుంది 20 years before, if we compare the cancer incidence in female in India, only India, I will talk about only India, the most common cancer was cervical cancer. ఇప్పుడు ఏమైంది, breast cancer has overtaken the cervical cancer and it has become the number one cancer in India. ఎందుకు? The reason is the cervical cancer is mainly because of your hygiene. The most common organism involved for cervical cancer is a HPV virus which causes cervical cancer, whereas breast cancer is a lifestyle disease. It is more seen in more of the urban people rather than rural people. So ఏమైంది, because of improvement in hygiene and becoming more of the westernized culture, eating more of the junk food, not having children's, getting children at the late age, all this risk factor increases the incidence of breast cancer.
Okay, what exactly is a breast cancer? Who is more prone to it, and is it any particular age group in danger?
To understand breast cancer, let us understand first what is cancer. ఏమవుతుంది, if the cells in your body undergoes multiplication 100 times, 1000 times, million times and form a mass, it is called cancer. Cancer is not something which has entered from outside. It is your own cells, but the number of cells in your body is constant. Example, if I have some X number of cells, tomorrow also the number of cells will be X. ఏమవుతుంది, the dead cells will be removed by the body. In cancer ఏమవుతుంది, the cells keeps on multiplying and form a mass. Till it is in the one place, it is not dangerous. But later stage ఏమవుతుంది, it spreads to other part of the body like liver, lung and bones. Same thing, if it happens in the breast, it is called breast cancer. There will be cells of the breast which will keep on multiplying and form a cancer.
Okay, and who is more prone to it?
Yes, the breast cancer incidence is more commonly seen after the age of 45 years. As the age increases, the chances of breast cancer also increases. But now little bit we are seeing the different scenario. 10% of the cancer we see in young age also. We call it cancer in the adolescence. We see in less than age 35 year also breast cancer. Last week treat chesano, one 25-year-old female who presented with breast lump. To be frank, I also never thought it is a cancer, but once I did the biopsy, the report came as cancer, to our surprise. So, but 90% of the cancers are seen after the age of 45 years. Yes, less than 45 years also we see some cases in female.
అంటే ఇది హెరిడిటరీగా వచ్చే రిస్క్ అంటారా, లేకపోతే
5 to 10% of the cancer in India are hereditary. ఏమవుతుంది, మీ మదర్, సిస్టర్స్ ఆర్ మదర్స్ కజన్ ఎవరి క్యాన్సర్ ఉంది మీన్స్ the chances of cancer coming in you is little bit high. 5 to 10% of the cancer are seen in family because of mutation in the gene we call BRCA genes, BRCA1 and BRCA2 gene. But 90% of the cases still are sporadic.
ఓకే, మీరు చెప్పేదాని ప్రకారం హెరిడిటరీగా వచ్చిన సెడెంటరీ లైఫ్ స్టైల్గా వచ్చినా కూడా ఇప్పుడున్న పేరెంట్స్ చాలా జాగ్రత్తగా ఉండాలి వాళ్ళ పిల్లలకి రాకుండా ఉండాలంటే.
కరెక్ట్. ఎవరి క్యాన్సర్ ఉందా మీన్స్ డెఫినెట్లీ యువర్ చిల్డ్రన్స్ హ్యావ్ ఎ రిస్క్, దే మే ఆల్సో గెట్ క్యాన్సర్. సో బిలో ద ఏజ్ ఆఫ్ 45 years ఒకటి సింపుల్ అల్ట్రాసౌండ్ చేయించుకోండి. అల్ట్రాసౌండ్ నార్మల్ వచ్చింది మీన్స్ ఏం భయపడదో ఏం లేదు. ఆఫ్టర్ ద ఏజ్ ఆఫ్ 45 1 mammogram చేయించుకోండి. వన్స్ యువర్ 1 mammogram is normal, no need to worry for 3 years.
Risk factor for the breast cancer అంటే is it age, gender? ఏజ్ గురించి మీరు చెప్పారు 25 years అమ్మాయి కూడా వచ్చిందని. సెడెంటరీ లైఫ్ స్టైలా, ఇంప్రాపర్ ఇన్నర్ క్లాత్సా, ఎలా?
Yeah, the main risk factor for breast cancer is the unopposed estrogen in the body. Estrogen is the hormone which is secreted by the ovaries in the female. If the estrogen level increases in the body, it is a risk factor for breast cancer. There are many reasons why estrogen will be increased, like early menarche or late menopause, but this is not in one hand. What is in one hand which can prevent cancer and which is proven by some study is having children below the age of 30 years, breastfeeding. So Indian culture was early marriage, early birth child and breastfeeding, which was a protective for breast cancer. Ippadi emaindi because of westernization, like more people are working, more females are working, they are getting married late, they are having children late, and maybe they are not breastfeeding or breastfeeding for the shorter time, which all are risk factor for breast cancer.
ఓకే, అంటే సిమ్టమ్స్ ఎర్లీ సైన్స్ ఏ విధంగా ఉంటాయంటారు, ఎలా గుర్తుపట్టొచ్చు?
First most important symptom is lump, swelling. 90% of the patient will present with swelling in the or lump in the breast. Rest of them can present with other symptoms. I don't want to discuss because I don't want to confuse them. Just remember, if anybody having, any female is having any swelling in the breast, let it be present for long time, pain is there, pain is not there, it is associated with the fever, don't worry. If you have any lump, any WAP is there in your breast, please go to the doctor and get yourself evaluated.
Okay, most of the women screen having a lumps in the breast. Is it really a cancer?
Yeah, very good question. 90% of the lump in the breast is not cancerous. They are benign. Example, fibroadenomas, which is very commonly seen in many female. Most of the lump, as I told, is not cancer. Only 5 to 10% of the lumps are cancerous lump. But you don't know, a layman don't know whether it is a benign or it is a malignant. It is coming in 90% category or 10% category. For that you have to get evaluated. Show to the nearby doctor, physician, surgeon, get yourself evaluated. Surgeons or physician tells this is not cancer, you are free. But until proved otherwise, take all lump as cancerous.
అంటే మీరు అంకాలజిస్ట్ కాబట్టి, లాప్రోస్కోపిక్ సర్జన్ కాబట్టి, యు ఆర్ నాట్ ఫియర్, యు నో అబౌట్ ద డిజీజ్ వెరీ వెల్. బట్ కామన్ పీపుల్ డజంట్ నో. క్యాన్సర్ అనగానే దే విల్ అక్కడే చనిపోతారు యాక్చువల్లీ. సో షుడ్ ఎవ్రీ విమెన్ బి అఫ్రైడ్ ఆఫ్ క్యాన్సర్?
ఎవ్రీబడి ఐ విల్ టెల్, డోంట్ బి అఫ్రైడ్ ఆఫ్ క్యాన్సర్. Cancer is not equal to death. Sometimes I tell to my patients, my disease is better than diabetes and hypertension. ఎవరికి డయాబెటీస్ హైపర్టెన్షన్ వచ్చింది మీన్స్ లైఫ్ లాంగ్ యూ హ్యావ్ టు టేక్ మెడిసిన్స్. బట్ ఇన్ క్యాన్సర్ ఇట్ ఈస్ నాట్ లైక్ దట్. యూ అండర్గో ప్రాపర్ ట్రీట్మెంట్ అండ్ యూ ఆర్ క్యూర్డ్. జస్ట్ కమ్ ఫర్ ఫాలో అప్, షో అండ్ గో. క్యాన్సర్ ఈస్ నాట్ ఈక్వల్ టు డెత్. ఐ వాంట్ టు రిపీట్. The only reason why people think cancer is equal to death is the death rate is very high in cancer. It is not because of cancer. It is because of late presentation to the doctor. 70 to 80% of the cancer in India are presented to the doctor when it is stage 3 and 4. Only 10 to 20% are presented in stage 1. What are stage 1 to 4? Stage 1 means lump is not spread to any other part of the body. It is confined to the breast. Stage 4 ఏమవుతుంది? It has spread to other part of the body like liver, lung or brain. In stage 1 the cure chance is very very high. So if you undergo treatment in stage 1, your cure rate is more than 95%. No need to be afraid. But the bad luck is they present to the doctor when it is stage 4, where we cannot cure, only we can control the disease.
And a time between screening to screening?
Screening can be of two types. One, whether you can do at home, or one which will be done at the hospital. Doing at the hospital is definitely time consuming. You require instruments, you have to pay for that. But there is a simple self breast examination which can be done by all the female sitting at home once a month. The recommended is you have to do once a month. Just stand in front of the mirror, lift your hand and clockwise assume your breast to be a clock. Start with 12 o'clock position, then 1, 2, 3. Just go on palpating, see any changes is there. If you feel any changes, if you feel any swelling, if you feel any lump, if you feel any discharge, present to the doctor. This is the screening which can be done at home. We call it self breast examination, and recommendation is to do it once a month. Second is screening we do at hospital by either ultrasound or by mammogram. The recommended age is after the age of 40 to 45 years, and we recommend it every once a year.
Okay.
So like this you can screen at home also, at hospital also. The patient which got breast cancer at the age of 25 is very very unlucky, I will tell. But everybody is not like that. You will have a window, screen to screen time, what you are asking. They have a window when you present. If you palpate today is not there, at least next month you can feel that lump. present to the doctor, and if it is cancer also, it will be only stage 1. You will be cured completely.
The women are more prone to this breast cancer. What about the male?
Correct. The myth here is male will not get breast cancer. It is wrong. 1% of the breast cancer in India is seen in male. Male do get breast cancer, but 90.9% of the cancer we see in females only.
Okay. What is the latest treatment available in Star hospitals?
The latest treatment, first of all, the treatment for breast cancer or any other cancer, we call it as multimodality treatment. Ikkada em avutundi, it is not the only surgery part. It is surgery plus radiation plus chemotherapy, which includes targeted therapy and immunotherapy. The treatment in breast cancer depends on the stage when you are presented to the doctor. If you present to the doctor in stage 1, your treatment is very short. Maybe you will not require all the modality of treatment. But if you present in stage 3, you require all modality of treatment. To tell you with the example, in stage 1, when you present to the doctor, if there is a breast lump of 3 centimeter and you are of a good type of breast cancer, then with only surgery and hormonal treatment you will be cured. No need for chemotherapy and radiation. Other, you present in stage 3, when the lump size is 5 centimeter and already it has spread to the lymph nodes, you require surgery also, followed by chemotherapy also, followed by radiation also. Your cost will also increase, your suffering will increase. So to reduce all this and improve the cure chance, the only dictum is present early. Present in stage 1, I can guarantee the cure chance is more than 90%.
Okay.
So with the help of your channel and media, I want to urge my viewers, if you have any symptom, any lump, you feel any change, don't shy. Don't sit at home. Please share with your family, share with your husband, share with your doctor. Get evaluated. I will pray should not be cancer, but get evaluated yourself.
ఓకే, మీరు చెప్పిన దాని ప్రకారం ఫస్ట్ స్టేజ్లో వస్తే క్యూర్ అవుతుంది 90%. ఫస్ట్ స్టేజ్లో వచ్చి క్యూర్ అయిపోయిన తర్వాత ఒక బ్రెస్ట్కి వచ్చి నెక్స్ట్ బ్రెస్ట్ కూడా వచ్చే ఛాన్స్ ఉంటుందంటారా?
Breast cancer patient, if we compare from a normal person, the chances of getting cancer in other breast is 4 times more. So ఏం చేస్తాను అంత పేషెంట్స్, we call them every 3 months and do examination and do mammogram once a year to see that the other breast is not developing cancer.
ఇప్పుడు క్యాన్సర్ ట్రీట్మెంట్ స్టార్ట్ చేసిన తర్వాత వాళ్ళు ఎలాంటి ప్రికాషన్స్ తీసుకోవాల్సి ఉంటుందంటారు?
క్యాన్సర్ ట్రీట్మెంట్ అయిపోయిన తర్వాత ద ఫియర్ వాట్ వీ హ్యావ్ ఈస్ డిసీజ్ కెన్ కమ్ బ్యాక్ అగైన్. That is the biggest fear any oncologist will have, including me. So what we do, we want to make sure that if it come back also, we can catch it early and cure it early. So what we advise is, every 3 months we call the patient. Patient వచ్చే తర్వాత we do thorough clinical examination, ask history if they have any symptoms. Examination if it is normal, if required, we do mammogram or ultrasound to see. If it is normal, very happy. So the only thing which is required from my patients is, once the treatment is over, don't neglect. Come back every 3 months, just get one examination done and you will be safe.
ఓకే, సిమ్టమ్స్ అని ఇందాక చెప్పారు కదా మీరు, సిమ్టమ్స్ అందరికీ ఒకేలాగా ఉంటాయా? కొందరికి మీరు ఇందాక స్వెల్లింగ్ అన్నారు, ఇంకొందరికి సెల్ఫ్ ఎగ్జామినేషన్ చేసుకుంటే తెలుసు, కొందరికి తెలియదు కూడా.
కరెక్ట్.
ఎలా?
దట్ ఈస్ ద బ్యాడ్ లక్. ఏమవుతుంది, 5% ఆఫ్ ద క్యాన్సర్ they present to the doctor very early only, like they tell the lump I have seen in 7 days, but once we do the examination we see that the disease has spread to the liver and lung. That is one bad thing about cancer. 5% of the cases they present early only, but already it has spread to the other part of the body. We can't help such patients.
ఇన్ని సంవత్సరాల సర్వీస్లో మీకు హ్యాపీయెస్ట్ మూమెంట్ పేషెంట్స్ ఎప్పుడు వచ్చింది మీకు?
పేషెంట్ క్యాన్సర్ రాలేదు, that is the happiest. Okay. First of all, patients should not come to me only.
Okay.
If they come also, second happiest moment is if it is stage 1.
Okay.
Third happiest moment is they undergo complete treatment and the disease will not come back.
Okay.
So first, disease should not, nobody should have cancer. Second, if cancer is their bad luck, it should be stage 1 and they should be completely cured and disease should not come back.
ఇట్స్ వెరీ నైస్. అంటే ఫస్ట్ ఒక క్యాన్సరే రాకుండా ఉంటే మీరు హ్యాపీ అన్నారు. క్యాన్సర్ అసలు రాకుండా ఉండాలంటే ఎలాంటి ప్రికాషన్స్ తీసుకోవచ్చు? ప్రికాషన్స్ తీసుకుంటే రాకుండా ఉంటుందంటారా?
ఛాన్సెస్ ఇస్ దేర్. టు దిస్ వీ షుడ్ నో వాట్ ఆర్ ద రిస్క్ ఫ్యాక్టర్. ఫర్ యువర్ క్వశ్చన్ ఐ విల్ జనరలైజ్ ఇట్ బికాస్ దిస్ ఈస్ జనరలైజ్డ్ టు ఆల్ ద క్యాన్సర్ ఇన్ ద బాడీ. Cancer is nothing but a fight between the bad cells and your body. So if we can kill the bad cells, how we can kill? Either you increase your immunity or make sure that the risk factor is not there which can cause cancer. To give you example, tobacco. 30% of the oral cancer in India is because of tobacco. If you remove tobacco from India today, 30% of cancer will come down. Not possible, very difficult. So one thing, remove the risk factor. Example, tobacco for oral cancer, lung cancer, alcohol for liver cancer. Second, increase your immunity. How to improve your immunity? Eat more of the healthy diet, more fruit, vegetables, more of the cereal, pulses, less of the junk food. Maintain a proper healthy weight. Don't be obese. And most important, be physically active. Every day, minimum 30 minutes you should spend for your body. Do whatever you like. Walking, jogging, playing some sports like badminton, table tennis, squash, anything you play. But minimum 30 minutes you should spend on your body to increase your immunity. Not only cancer, this will prevent other diseases like your heart problems and lung problem also.
Okay.
Simple, remove the risk factor like tobacco, increase your immunity by doing physical keeping yourself physically fit, not being obese, and eating less of the junk food, eating more of the healthy food.
రైట్, మీ దగ్గరికి వచ్చే ఈ మధ్య కాలంలో ఎక్కువగా ఏ టైప్ ఆఫ్ కేసెస్ వస్తున్నాయి బ్రెస్ట్ క్యాన్సర్లో?
బ్రెస్ట్ క్యాన్సర్ 70% ఆఫ్ ద కేసెస్ స్టేజ్ 3 వస్తుంది. ఓన్లీ 10 to 20% క్యాన్సర్ స్టేజ్ 1 వస్తుంది. ద ప్రాబ్లమ్ ఈజ్ అగైన్ యాజ్ ఐ టోల్డ్ యూ, నెగ్లిజెన్స్. బీయింగ్ అ ప్రైవేట్ పార్ట్, మోస్ట్ ఆఫ్ ద ఫీమేల్ డోంట్ షేర్. I tell at least share with your husband. Or if you are shy, go to the gynecologist who are female, let them examine. If they are any suspicious, they will send to an oncologist. But the reason is, please don't neglect it. That is my point.
ఓకే, నెగ్లిజెన్స్ చేయకుండా ఉంటే వాళ్ళకి ఫస్ట్ స్టేజ్లో ఉంటే ఒకవేళ అది క్యూర్ అయిపోతుంది అని చెప్తున్నారు.
Guarantee 90% cure rate is there in stage 1.
ఓకే, మనం తీసుకునే ఫుడ్ ఎలా ఉండాలంటారు? మీరు అందరు చెప్పే డాక్టర్సే, ఎస్పెషల్లీ మీ వే ఆఫ్ నుంచి ఎలా ఉంటుంది?
Include more of the fruits and vegetables, avoid more of the oily food. So, and most important, you eat, does not matter, మీరు ఏం తింటారో అది యూటిలైజ్ చేయండి, burn that calories.
Okay.
So like if you are taking 2000 calories, do some physically activity and make sure you are fit. That is the most important thing.
Okay.
Input should be equal to output.
Okay.
Input is more, output is less, you will become obese. It's a risk factor for not only cancer, for your cardiovascular diseases also.
రైట్, ఫైనల్గా మీరు ఏం చెప్పాలనుకుంటున్నారు ఆడియన్స్కి?
Audience, most important first is do self breast examination.
Yeah.
Very, very important. Once a month, stand in front of the mirror. If you feel any changes, if you feel any lump, present to the doctor. Self breast examination is very, very important. And with Star Cancer Center, we are doing many screening program. మీరు చూసారా, with Chiranjeevi Foundation, with Rotary Club, with Lion Club, we are doing many screening program where we do free of cost Nirmaya mammogram for assessment of the breast cancer. Please utilize it. If we are coming to your apartment or your colony with the help of Chiranjeevi Foundation or Rotary Club, please utilize it. Do yourself evaluated by mammogram. And if possible, you can come to nearby hospital. Please come and get yourself evaluated by mammogram, which if normal, you are completely free. Example చెప్తాను మీకు. లాస్ట్ వీక్ ఒకటి పేషెంట్ వచ్చారు విజయవాడ, 45-year female. She didn't had any problem. She came for only cardiac evaluation because she underwent stenting 2 years back. Mammogram చేశాను. There was a lump 1 centimeter in the breast, right breast. So what we did, we evaluated. Luckily the lump was only in the breast. She underwent breast conservative surgery. In breast conservative surgery, we don't remove the breast completely, we remove only the affected lump. So still in breast cancer also we can preserve your breast provided you present early. Complete rheumatoid అవసరం లేదు. So we can remove only the lump and you will be cured. So this patient with 1 centimeter lump, we removed only the lump and she is cured now. No need for chemotherapy, no need for radiation.
ఓకే, ఏ స్టేజ్లో మీరు కంప్లీట్ బ్రెస్ట్ రిమూవ్ చేస్తారు?
Stage కాదు, this is the size which is more important.
Okay.
What we see is what is the size of the breast, what is the size of the lump. If we can give a good cosmesis, example, if the lump size is less than 3 centimeter, I have to give 1 centimeter of margin all round. 5 centimeter breast తీసేస్తాను. After removing the 5 centimeter of breast, if the breast cosmesis is good, offer చేస్తాను. But if you present to the doctor when the lump size is 7 centimeter, 8 centimeter, then this surgery will not be possible. If you ask my experience, among 100 cases, if I take an example, 40% patients are eligible for breast conservative surgeries, where we don't remove the complete breast.
Okay.
We remove only the affected lump and give radiation to prevent cancer coming back, and they are cured.
అంటే రేడియేషన్ ఇస్తే మొత్తం గ్లామర్ తగ్గిపోతుంది, యాజ్ వీ సీన్ అంటే సెలబ్రిటీస్ని కూడా చూసాము, గ్లామర్ తగ్గిపోతుంది, ఇప్పుడు ఇది నాకు రిస్క్ అవసరమా అనుకునే వాళ్ళు కూడా ఉంటారు కదా డాక్టర్.
చూడండి, రేడియేషన్ ఈజ్ హ్యావింగ్ మెయిన్లీ ద లోకల్ ఎఫెక్ట్స్.
ఓకే.
సో ఏమవుతుంది, వీ గివ్ ఓన్లీ రేడియేషన్ టు ద చెస్ట్ వాల్ వేర్ ద బ్రెస్ట్ ఈస్ లొకేటెడ్, వీ డోంట్ గివ్ ఇట్ టు ద ఫేస్. Chemotherapy will cause systemic side effect, hair loss,
yes,
but not radiation. Radiation will cause only the local side effect, like little bit blackening of the skin, which is temporary, which will be fine after 3 to 6 months. But chemotherapy can cause loss of hair. Again, it is not permanent.
Okay.
Once you stop chemotherapy, the hair will come back.
అంటే క్యాన్సర్, బ్రెస్ట్ క్యాన్సర్ రావడం ఎలా వస్తుంది, వస్తే ఎలాంటి ప్రికాషన్స్ తీసుకోవాలి, ట్రీట్మెంట్ ఏ విధంగా ఉంది, అన్నీ కూడా చాలా చక్కగా వివరించారు డాక్టర్. థ్యాంక్ యూ సో మచ్.
థ్యాంక్ యూ.
ఇది ఇవాల్టి లైఫ్ లైన్. చూస్తూనే ఉండండి TV9.